Thanks for visiting my channel. I'll be talking about Hereditary Angioedema Type 2. If you haven't listened to Type 1 or full presentation on angioedema without urticaria, please kindly check my channel here. So, for full presentation on Hereditary Angioedema Types 1, 2, and 3, and also acquired angioedema and idiopathic angioedema, kindly check the link below. Okay, you can copy and paste. Now, hereditary angioedema type 2. This is close to about 20% of all hereditary angioedema cases. The main issue here is that C1 esterase inhibitor will not function normally. So we have abnormal function of C1 esterase inhibitor. It is a genetic problem, and inheritance is via autosomal dominance, meaning you need only one of the parents to supply the gene, and there will be the disease. So, there is angioedema, but there is no urticaria. Then, consider bradykinin-induced angioedema in that circumstance. We have to stop certain medications immediately. For example, the person is on Ramipri or Catopri, that is AC inhibitors, or angiotensin receptor blockers, or non-steroidal anti-inflammatory drugs, or DPP-4 inhibitors. We have to stop them. Then we will check for the C4 level. If it is normal, that is not the end of the road. We will repeat the test during the next acute attack. Now, still angioedema, no urticaria, another acute attack is right here. Okay, we have to determine the level of C4 right now. So, we must remember, we must determine the level of C1 esterase inhibitor also. So, the level of C1 esterase inhibitor and the function of C1 esterase inhibitor must be determined. We can also check for C1q level. The expected results will be that C4 level will be low, C1 inhibitor level will be normal or raised. Let me repeat. C1 esterase inhibitor level is expected to be normal or raised, while C1 esterase inhibitor function will be decreased. But C1q level will be normal. So the issue here will be two things that will be obvious. C4 level is low, C1 esterase inhibitor function is decreased or abnormal. So in addition to what we've just gone through on the previous slide, right, we'll take family history. Here it will be positive. And this presentation will be at the early part of life. This is likely going to be a child or an adolescent. Why that? We want to be sure we are not dealing with acquired angioedema. And why is that important? You will know by the time I publish presentation on acquired angioedema, where you must look for the cause, either autoimmune or malignancy somewhere. Okay, but we'll leave that to them. Now, in acquired angioedema, no positive family history, and it will present late in life. So once we're able to rule that out, and the parameter from the complement studies has given us C4 level that is low, C1 esterase inhibitor level that is normal or even raised, C1 esterase inhibitor function that is abnormal, and C1q level that is normal, then you can conveniently make the diagnosis of hereditary angioedema type 2. For further details on diagnosis of angioedema without urticaria, you can check my channel here, Total Vicar Meds, and the link below. Now, what are the possible triggers? Pregnancy, certain foods, cold exposure, viral illnesses, particularly in children, emotional stress, tongue piercing, trauma, surgery, dental procedures. More. Do we need more? Absolutely. We need to know more. This is not the end of Hereditary Angioedema Type 2. For full diagnosis process, because complement study is just a component of many things we can do while making the diagnosis. And also to know the pathogenesis. How can bradykinin induce angioedema and there will be no urticaria? Signs and symptoms, differential diagnosis. How can we treat this case in acute phase? Prophylaxis on short term, prophylaxis on long term. What are the medications that will be used? For example, in acute case, we are going to go for C1 esterase inhibitor replacement, purified form. Okay, that is just the first drug of choice. This is not the issue of antihistamines. No, it's not going for corticosteroid. No. But you will get the full info when you go through the link provided here. Just click on this or copy and paste. You will get full info on all this. Thanks for listening. Remember to share. Remember to subscribe to my channel. I appreciate it.